Hey guys, how are you? I'm Dr. Dana. Nice to meet you. If I haven't met you already, this is my first time trying to stream live here, so I am using StreamYard. Looks like it's not working on my Twitter account, but I know my title is a little bit provocative of tonight's live stream, and there is a reason for that. My primary reason is I want people to understand that if you feel like you have been gaslit at some point by the traditional Western medical system, coming from a traditionally trained Western medicine doctor, you are not alone. And, I think that this is having that personal experience myself is probably what really drove my desire to know that I needed something more. Like I needed to do something more with my medical training. So a little bit about me, I'm a board certified family practice physician. Um, and I did do a residency in family medicine. I went back to school at 28 with a 6-week-old infant, so not for the faint of heart. And I realized early on that I just felt like something was a little bit off. Um, I remember my first experience. I was in my first year of medical school, and my child, was like, "Oh, he has to get vaccinated," and I of course, went to the pediatrician. I was like, It just feels like there's something wrong with Pentosil. Like this is 5 vaccines in once. I'm a little concerned. Do we want to be giving him 5 vaccines? And at the time, I was taking, my immunology and microbiology, and we were learning about inflammation and what happens when inflammation, or how inflammation can actually turn on and off this thing called methylation, meaning that you can actually turn on and off the expression of DNA. And, so you may have, like, for example, a genetic variant for a certain disease process, but it's turned off, it's quiet. The proteins are not being replicated. And with inflammation, it can actually turn that process on, and then you have expression of the actual disease and symptoms. And so I asked the pediatrician at the time, and I said, and this was a pediatrician actually at my medical school, I won't name any names, and that was the first time I really felt completely gaslit by the system. I was almost shamed. I was shamed. I was shamed to, and I was like, you're in medical school, you're in training, like you should know better. This is standard of care, And I wasn't questioning, I wasn't saying, oh, questioning all vaccines. I was just like, I feel like something's wrong with giving my little baby infant 5 vaccines at once. So fast forward many more years, and I was in residency in my first year, and I was hit hard. I was diagnosed with 2 different autoimmune conditions. And I, had very little time. I had no time to rest. It was just 80-hour work weeks. I had a young child at home, and I started doing the research that I could in terms of, like, are there other options? Do I need to just be on steroids for the rest of my life? There's got to be something else. Like, what's causing the inflammation in my body? Maybe I had Lyme disease as a child. Could that have been the cause? Are there any alternatives to these just standard treatments? And I found that when I started questioning that, I went to, like, the top specialist at Penn. I looked up who was doing the research on the condition, and I was just ashamed. It was like, you're a resident. You should know better. Like, why are you even inquiring about this? And you know what? I ended up turning my condition around significantly, my specific condition, with an elimination diet, and figuring out, like, oh, there was a food, and one of my conditions was eosinophilic esophagitis. And, so that is very much impacted by food. I'm not saying that every autoimmune condition can be changed as such, but the point is that I was shamed for wanting to explore other, more alternative options. I never want someone to have to go through that. And I know a lot of you have been through that. I know a lot of people have been through this, feeling like they've gone in to just try to ask questions. And hey, that's the basic premise of science, right? We ask questions, we question things, and then we seek answers. And I can go over, I think I started a series on, like, the 20 different drugs or treatments that were considered standard of care that we later pulled back and said, oh no, this is a problem. Like these should not have been standard of care. I mean, the opiate epidemic is like one of the biggest ones where they were pushed as standard of care for chronic pain for the longest time. And obviously we realized that it was extremely hurtful for people, detrimental to health, was killing people. I still have people who are on chronic opiates that come to me, by the way, and they don't even realize what is happening in their bodies from being on the chronic opiates, and that maybe there's an alternative method for pulling off of these opiates. So anyhow, I just wanted to sort of put that out there that if you were one of those people who felt like you were gaslit by the system, your experience is real. And I apologize on behalf of my profession that that ever happened to you. So fast forward many years, I ended up as a single mother for a while. I have an amazing partner by my side now. And so anyhow, I fast forward many years and I ended up going to work some addiction medicine outpatient because I really have always been fascinated by mental health. I struggled myself for a while. I felt very abused during residency, and I've struggled with anxiety and depression and have found methods that don't involve medication administration. And instead, I'm finally sitting for my 200-hour yoga teacher training after being a daily yogi for many years and finding solace and peace in the inward nature of meditation. So I will talk to anybody and everyone about yoga, breathwork, meditation if you're willing to listen to me or engage in a conversation with me. But I was working outpatient addiction medicine. I saw so much pathology that was like, wait a second, are we labeling this? Is this constant pathology? Is this forever pathology? Meaning, I would say that the majority of people that are in active addiction or like just sober from active addiction and starting to get treatment can often exhibit personality traits of borderline personality disorder and bipolar. And we start to label people with these mental illnesses, right? Does that mean that they're always going to be bipolar? I mean, I would say the majority of people in outpatient addiction treatment and also in eating disorder treatment get slapped with a bipolar diagnosis, for example. And the way I started to really see it and feel it in my heart was like, wait a second, is this really a bipolar diagnosis, or is this just pure emotional dysregulation? I mean, it is emotional dysregulation that gets someone to the point of having to use some sort of external substance, whether it's food, drugs, alcohol, whatever it is. You're using this external substance to calm whatever storm is happening within you, right? Whether you're having anxiety or, and so I started to view things less as diagnoses and more as, okay, in this moment, this person is struggling with such and such a thing. In this moment, this person is struggling with regulating their emotions, right? This is a highly sensitive individual, for example, and they're sensing a lot of anxiety around them and they're sensing stress. And so I started realizing my view of diagnoses wasn't quite in line with the Western medicine algorithm where it's oh, this person meets the DSM criteria for bipolar disorder and, voila, they check off all the list and we're going to put them on a mood stabilizer and send them on their way and get them into therapy and all of that stuff. And I did eventually go to work urgent care because I wanted to get more hands-on experience. I felt with just straight outpatient addiction medicine, I was sort of losing my hands-on MacGyvering skills as well. And what I saw in urgent care, again, all of my experiences that were difficult at the time, I realized in some of my really horrible experiences in life that I thought were going to break me, I'm so grateful for now because I was able to get something from them. I've always gained something from the experiences that were very challenging for me. So I saw in urgent care, again, this concept of Western medicine separating the physical from the mental from the spiritual. And this was evolving as my yoga practice was evolving as well. And when I say yoga, by the way, there are the physical asanas of yoga, but there's also this whole other component of spiritual and mental. Um, and I started really feeling like I was going to quit medicine. I was like, I can't do this. You know, it was a great schedule because I could go home, and unlike my friends in family medicine who were going home and charting all night and like weekends, I couldn't do that. I had children at home already. Um, I just felt myself burning out, and I saw what was happening around me, and it was like, you know, patients were frantic because nobody wants to go to urgent care, right? They go to urgent care because you can't get a hold of your primary care doctor. You don't have a doctor that knows you. Um, and it's stressful because you're oftentimes waiting for an hour to 3 hours at a time. A lot of the local urgent cares are staffed with just one physician because, you know, insurance keeps cutting reimbursement. Um, and we have to see high volume there. Like, it's just, otherwise people get so frustrated because they're waiting for so long. And I started like having more and more people, especially I worked urgent care all throughout the pandemic. And I saw more and more people coming in for anxiety. People were bringing their kids in saying, my child is anxious and depressed and like, I don't know what to do. And their primary care doctor, I can't get a hold of them, or for whatever reason, or they don't have a primary care doctor. And I was like, I think I can help you, but I can't help you here because I will get fired unless I'm seeing like 5 patients to 6 patients an hour, which gives you about 7 minutes of my time right now in between charting and going from room to room. And I started feeling really sad. It was like just a deep sadness that came over me. And I looked into leaving urgent care and going into primary care, and I just couldn't do it. Insurance-based primary care, I could not do it because I was seeing it was like the same environment, right? But a little bit different. So you now had to, and this was the perspective, deal with more issues for people. Like, that's a horrible way to say it, but that's like what, you know, there's more stuff you had to deal with for people in the same amount of time. And it's like, that doesn't work either, right? Um, and And so I had been doing research for about 5 years on a model called direct primary care. And that's sort of what I'm leading into with this presentation. There's so many different types of direct primary care doctors. And if you just simply put direct primary care into YouTube, you'll find a lot of like the legends in primary care. Oh, hey, Tom, what's up? You'll find a lot of the legends. I'm so honored you're here. You'll find a lot of the legends in direct primary care. Speaking at different conferences and really get to understand what it means. But it really is every direct primary care is a little bit different. Every doctor is a little bit different. We all bring our own spunk and to our model, but the base model is the same. And it was created to reconnect patients and doctors again. It was created to make medicine great again, and no politics here, but it was created so that we would all get our time back and we would get our accessibility back. And it has proven to do just that for me. You know, I was so scared to make the jump. I was so scared to leave employment. I was like, I left with no patients. I just left with like handing out cards to people saying, hey, this is my new venture. I'm leaving, because if I don't, I'm quitting medicine. And I did not go back to medical school at 28 with a 6-week-old infant to quit medicine right now. That's my former Division I athlete coming out. And so I left, and what direct primary care does is we can't fight the large insurance company mafias, and they are mafias. I say insurance companies, but they are the largest legal mafias that exist. So if you find me dead in a ditch somewhere, you know it's one of them that did it at this point, because I've been speaking out a lot about this. They are not transparent. I don't know how they get away with doing what they do. But they do, because they're lobbying Congress with millions and billions of dollars per year. And so we just basically said, okay, well, we can't fight these mafias. We can't do it. We don't, it's a useless waste of energy. So we will circumvent them, right? And what does that look like? Like, how do we make this so it's affordable for patients? I want my patients to be able to get a hold of me when they actually need. Like, I don't want, as in the last year, I have maybe had one patient go to urgent care because I wasn't available, but they talked to me first and we made the decision together. So patients just text me directly, and this is with most DPC doctors, and everyone's a little different. So you just, interview the doctor and figure out what works for you. Um, and my appointment times are extended, meaning like the minimum follow-up I schedule is a half an hour. And that's just me face to face with people. Like there's no front desk, it's just sort of people coming in and sitting down. And what that does is it gives us our souls back, right? Like when I have time to sit down with my patients and say, hey, what's going on? Talk to me. Or I know, for example, I know my patients now. So I know that some people are more stoic and others have more health anxiety. No judgment either way. But that's important for me to know as a doctor when I have somebody calling me up and saying, I am really sick right now. I'm having shortness of breath. I'm having problems breathing. That's important in terms of evaluating someone is knowing their temperament, knowing their disposition, right? And having time to say, hey, listen, come on in. Like you're sick. Come in. I have an opening. I save a certain amount of appointments each day for sick patients. So come in and let me just take a look at you real fast. Or at minimum, getting on the phone with people. Like if I can just get a visual or hear someone's voice and say, hey, let's talk this through. What's happening? Does this need to be seen today or can I bring you in next day? And I have not yet failed in getting people in same and next day for appointments. And my patients are all really respectful for the most part. Like they text me or call me after hours. If it's something where they're like, I don't know if I need treatment now. I don't know if I need to go to urgent care. Could urgent care be prevented? And I tell people, listen, I want to hear from you after hours if that's the case. Like, I don't want you to end up in urgent care. That's the whole purpose, is you should be heard and seen by a doctor that knows you, that knows your medical history. So much better for your health to have that happen that way. And it allows me to see people holistically, meaning I'm no longer doing what I was trained to do, which was like have the physical diagnoses in a box over here, and then like sort of ignore the mental and the spiritual aspect of things, because there wasn't time for that. This was ignored. There's not time in 7 minutes for that stuff. You just have to say, oh, what are your symptoms now? Do you need an antibiotic or not? Move on. Have you hit all of your milestones for your, have you gotten your mammogram? Have you gotten your colonoscopy? Have you gotten, insurance companies penalize doctors for, number one, well, HMOs specifically. Let's talk about HMOs. That's the worst. They penalize doctors for sending you to a specialist. Like they penalize primary care doctors. They take money from them if they send you out to a specialist. So they're going to try to avoid that as much as possible, do as much in-house, but they don't have time to do it in-house. Anyhow, enough about insurance mafias. I'll do a separate presentation on that. The purpose of this was simply to tell people that if you have felt gaslit by the Western medical system, I am very, very sorry, and I'm apologizing on behalf of my profession. And I wanted you to know about this other model of care. With direct primary care, you pay a monthly membership fee to your doctor. Everyone's a little bit different. We try to make it very affordable by decreasing our overhead costs, right? I'm not paying a whole back office and front office billing staff. I'm not high volume, so I don't have to pay multiple people to be at the front desk to answer the phones. I do most of this on my own. In fact, I don't even have a medical assistant right now. It's awesome. I'm probably going to be looking for someone soon, just one person that I can trust. But even then, if that were to happen, my patients know that they're going to get a hold of me when they're sick, right? They know that they're talking to me. If they have to go to urgent care, it's because I've discussed it with them and we felt like that was the best thing. And that's huge, I think, for people, is just really fully understanding that they can get a hold of their doctor. I have these stories in urgent care where, and again, I'm not mentioning any names, and a lot of this is driven by burnout, by provider burnout. You can't empathize with people when you are burnout. It's just impossible. Like think of if you're a parent, think of like when you're just done and you're like emotionally drained. It's been a very difficult day. The children have been fighting all day and you're just like, there's that one last fight and you're just like, I'm done. mom is off duty, I'm done, I have no, like, you have no emotional reserve left. And that's what happens in the healthcare field as well, where you're just so overwhelmed with like the volume that you're seeing and the charts that you have to do and the check boxes that you need to check, that when patients are calling over and over again to get a hold of the doctor that prescribed them the antibiotic last night, and they think they're having a reaction to the antibiotic, and they're just like repeatedly calling, they're not being annoying. That's not the annoying crazy patient, that's our system. That's what I started to realize. It was us as the doctors, it was us in the system. Like, whether it doesn't even matter whose fault it was, it's the system, because the patient got a prescription from someone and has a question or is having a reaction, and they just want to ask a question. They just, for the most part, and they get frantic because they think they're having a medication reaction and they can't get a hold of the doctor that prescribes it. And when they call a different doctor, the doctor's like, well, talk to the doctor that prescribes it. And so they are used to having to like call over and over and over again to maybe get a hold of a doctor at the urgent care that they came from. And I know that sometimes this happens in primary care offices as well, just because they're so busy. You know, I find that when patients know, and you guys, you know, everybody's been a patient at some point. It even happened to me, by the way. I should mention this. When I went to that doc at Penn, and I had to go back for certain things, and I had some questions, it was like I just dreaded trying to get through. It was like a pit in my stomach, because I would be like, oh my God, I'm not even, like, do I even bother calling? Like, I'm gonna be on the phone. I don't have time for this. I don't have time to go sit in the office for an hour while I'm waiting for this doctor. I don't have time to get on the phone with this person for an hour while I'm just waiting. I just have a quick question to ask, and I just need a quick answer so that I can make some decisions. And so, you know, it's our system that is failing us. And I would blame the insurance companies for this, because they just keep cutting reimbursement. And then that means we have to increase volume in order to pay the bills. But it's really burnout. It's burnout that happens, and you don't have emotional reserve when that burnout happens. And so those patients that were like calling over and over again, I would talk to other providers and say, hey, have you ever thought about it this way? It's not them, it's us. It's our system that we're in. It's like, this is the problem. It's the system. It's not them, you know, most of the time. Occasionally, there is that occasional like patient that has a lot of anxiety. Let's just put it that way. And like, it's a little bit extreme, but I think for the most part, most people are pretty reasonable. And when you know that you can get a hold of your doctor, I think it calms everything. I'm calm because I know my patients are happy and they can get a hold of me. And patients are calm because they know they can just shoot me a text message and they know I'm going to respond. And it's wonderful. It's absolutely incredible. So now when patients come into my office, I do, you know, a full hour and 15-minute intake. Some patients I know, when they're scheduling, they need a little bit more than a half an hour time for follow-up appointments, just because we have to talk about things. I know when people have died in their families. I know when they're having a hard time with their spouses. I'm humbled. I'm very, very humbled. When I think about this, I tear up, because I never imagined that I would be in a position where patients would trust me to this extent. And it's really, really nice to be able to fulfill what I feel like is something larger than me, you know. I have a lot of mom guilt for, you know, I didn't really see my son for a long time because I was in training. I had him, and then there was a lot of stress, and residency was really, really hard. I have a wonderful relationship with him now. He's going into 9th grade next year. But it was really challenging to go through that. And you don't go through that for no reason. You don't go back to school at 28 with a 6-week-old infant just because you feel like it. You don't go back to med school and residency. It felt like a calling for me. There was a reason why I did it. And so, you know, Love Health was created out of necessity, for people to be heard, for people to be seen, for people to be given the time that they deserve, for the whole person to be considered, right? Like, what's happening here? Is this truly all physical, or do we need to work on lifestyle interventions? what are you fueling your body with? Physically, food, mentally, and spiritually. How are you fueling your body, right? What are you doing for your movement? I call it movement, not exercise, right? What are you doing for that? What are you doing for your cortisol lowering activities? These are all really important aspects of overall health. And I always say, like, if I can teach people to have a healthy relationship with food, self, and movement, if I can teach people how to have a regulated central nervous system, then we will eliminate like 99% of chronic diseases for a lot of people. And I always say this, I say this over and over again, that a regulated central nervous system is the best gift, I think, that you can give to yourself and others around you. So yeah, I think I'm going to sign off now because it's like 10:05 and I've been at the office for a long time today. But I just wanted to try out this new streaming software that I got, and I really appreciate anybody and everyone who gave me the time tonight. And I'm going to be trying to do these live streams once a week, and I think they're hopefully going to just get posted everywhere. I have them on Facebook, YouTube, Instagram. Facebook, YouTube, and Instagram, my handles are just Dr. Dana, Dana, Love Health, all one, no spaces, nothing. Dr. Dana, Love Health. And I did just open up a Twitter account, but it's not streaming there right now, so I'll have to get that fixed up. But thank you guys all for your attention. I hope you give yourself the gift of looking into a direct primary care doctor for yourself. Doesn't matter if it's me. There's 1,100 of us on approximately right now around the nation, and the list is growing, and everyone's a little bit different. So I would encourage you to search for direct primary care. There is a website called dpcalliance.org. It's a great place. A lot of us are registered on that website, and you can find little bios on people. Yeah, any questions, you can reach out to me. The website is lovehealthdpc.com. And the email's on there. There's a contact form on there as well, but it's info@lovehealthdpc.com. In peace and health.